Hi, everyone. I am just trying to see myself on the screen. Can you guys see me?
Yes.
Okay, awesome. I don't know why I'm not seeing myself. Oh, here we go. I think I can switch it. Just give me a 1 minute here and then we'll get started. Okay, perfect. All right, great. Well, thank you so much for signing up for today's webinar. Hormone testing is a big topic that we talk about here at Thrive, and I wanted to take the opportunity to explain how we approach hormonal conditions at Thrive Holistic Medicine. So I know a few people are still jumping on, and don't worry, a recording will be available after the call. It'll probably take me a day or two, and then I'll send that out to everyone who registered. So comprehensive hormone testing, what your conventional doctor doesn't know. I chose this title specifically because so many patients have already been to their primary care doctor, maybe their OB-GYN or an endocrinologist, and they've had some tests done, but at the end of the day, they're told, pretty much you're fine, nothing's wrong. And it can be really frustrating when you don't feel well. So we look at more comprehensive hormone testing than conventional practitioners. All right, so a little bit about me. I'm a wife, a mother, naturopathic doctor, small business owner. I really enjoy being a naturopathic doctor to help figure things out. It's kind of like being a detective. We need to put all of the puzzle pieces together because you are one whole being, and there's different signs and symptoms going on in your body. There's different different specialists in the conventional medicine that will look at individual pieces of you, but I like to look at the whole person and figure it out. So I'm passionate about helping people reclaim their health using natural methods. And there's always something you can do to improve your health, even if you've been told otherwise. With naturopathic medicine, there's so many tools in our toolbox and ways to get you well. Part of the art of naturopathic medicine is choosing the options that you resonate with and that you're excited to implement, because there's more than one size fits all plan with naturopathic medicine. So my journey and passion regarding hormones. As a child, I definitely struggled with weight. I had some obesity issues, and even as an adult, my weight fluctuates up and down. Severe acne as a child or as a teen. In my early 20s, I got diagnosed with a hormone-driven autoimmune-related condition. And the condition is more common in menopause, so it was kind of rare. And besides a steroid cream, they're like, no, there's nothing you can do. You just have to live like this. But I didn't take that as an answer. I did not want to have that be my reality. So I started exploring natural options, and with homeopathy, with acupuncture, with herbs and supplements, and I was able to totally reverse my condition. I've been free of it ever since. So after becoming a naturopathic doctor, I realized how many people were suffering with hormonal issues and they didn't feel heard by conventional medicine. So often I'll have patients tell me that they go to the doctor, they express their concerns, and at the end of the day, there's not many solutions when conventional lab ranges are all normal. So I decided to dedicate my time to studying and learning how to help. When I first started practice, I initially started doing salivary hormone testing, and I realized that salivary hormone testing had some limitations. And that's when I went even further and I realized how much more in depth we can get with the Dutch test. And that's what we're going to talk about today. And I've seen hundreds of patients for hormone issues. So does any of this sound familiar? you're having hair loss, you put your hair up in a ponytail, put it under a hat, you're trying to see, if you can part your hair different ways because your hair is thinning and shedding and you don't know what to do. That could be because of hormonal imbalance. You're so tired. Tiredness can happen in different ways. Some people, the tiredness could be in the morning where it's a struggle to get out of bed, or you're hitting the snooze button over and over and over again, and you really dread that morning. Or on the other side of things, maybe in the early afternoon, you totally crash. Like you need to take a nap, you need to lay down, you're not able to be present with your family in the way that you would like to be. Or for women, your cycles are so painful or irregular, and you just can't handle it anymore. Maybe you're missing school or missing work because of it. And even if you're taking ibuprofen or conventional anti-inflammatories, it's very heavy, very painful. And you wonder, like, why isn't everyone suffering like me? Because of a healthy cycle should actually be pain-free. Or women on the other end of the spectrum, hot flashes, mood swings, emotional lability, these could all be related to your hormones. All right, so how about these? Despite doing all of the things, your weight isn't coming off. Maybe you've tried exercise, counting calories, maybe you're looking at different diets, and for some reason it's just really stubborn and you're not making much movement. It can be really frustrating. Or you don't feel like yourself anymore, you've never really felt well. Even the mental emotional symptoms can set into place when it's related to hormonal imbalances. Your symptoms are being dismissed by your conventional practitioners, or they just want to give you an antidepressant and send you on your way. There's so many times that I've heard of patients really suffering with hormonal symptoms, and when their conventional lab tests are normal, the doctor doesn't really know what to do, and they said, well, here's an antidepressant, maybe that'll help. And could it help? Perhaps, but at the end of the day, let's find a solution, right? Let's find a solution instead of masking it. So there must be another way and you just haven't found it yet. And hopefully the information that I'm going to share will be the next step in your healing journey. At Thrive Holistic Medicine, we help patients with so many different conditions. I listed quite a few here that are all hormone related. What's important to note about naturopathic medicine is that we don't necessarily zoom in on the condition alone. We treat the whole person. So we're going to view you as your own unique individual person. You have conditions, but the conditions, how they present in you, might be different than how they would present in somebody else. So we don't have a one-size-fits-all plan for any of these conditions related. We could have two people with the same condition come in and their treatment plans will vary because we're treating you as a person. Okay, so let's talk about the conventional approach that you may have already experienced. If you go to a conventional doctor, you'll have your first appointment. An appointment with a conventional provider, you're actually face-to-face with the provider, maybe 5, 10, 15 minutes at the most. So it's really brief. They quick go through all your symptoms. Sometimes they'll do a physical exam. A lot of times next, they'll send you on for some basic labs like CBC, CMP, so it's like complete blood count that looks at your red and white blood cells. CMP looks at liver and kidney function. Maybe you'll get a provider to look at maybe the first step for thyroid, so TSH. They do some lipids, maybe an inflammatory marker. So they'll do a handful of labs that are kind of the standard, the normal. And then they'll get the lab results back a few days later. They'll probably just message them to you on an electronic portal that they use and put their brief explanation. what I see over and over again related to hormones is that if they're looking at hormones, oftentimes they're doing a few very basic one, E2, estradiol, maybe progesterone, testosterone, DHEA. Here's the thing. In conventional labs, the way that they determine their reference range is by taking a sample of the population who's had the lab done, and they do a standard deviation. So their reference range is pretty wide, but for optimal health, a reference range is actually more narrow, so an optimal health range. So more often than not, your lab results may come back normal and they'll say, oh, everything looks good. But you're thinking, why don't I feel good? Like this can't be right. Something has to be going on. And it can be really frustrating. So for women, oftentimes the treatment options might be, okay, well, let's do some hormone replacement therapy or birth control. So taking birth control or hormone replacement therapy, although sure, it might help mask or manage some of the symptoms, it's not addressing the actual problem. It's not fixing the cause of the problem. And is there anything else that they could do? Perhaps if it's something severe, they'll say, let's send you in for a procedure. Let's do some more imaging. Let's do a surgery, perhaps even a hysterectomy. But besides, a lot of times for hormonal issues, besides birth control or surgery, there's not many other options conventional practitioners have. So our approach to care, in the first appointment, it's an hour and 15 minutes long, face-to-face with either me or Dr. Jorgis, our other naturopathic doctor. And we have this appointment linked so that we can thoroughly talk about the issues you have going on. So we're going to explain first a little introduction to naturopathic medicine, then we'll let you talk and go through your main concerns in whatever order makes the most sense to you. So some people will talk about their health chronologically, how it's changed over time. Other patients will go problem-based. Then we'll also cover diet and lifestyle questions. And from there, figure out the most logical steps moving forward, whether it be testing, supplements, dietary changes, or other therapies or modalities that we have to offer. So comprehensive labs, there's a saying that goes, test, don't guess. The Dutch test, DUTCH, stands for Dried Urine Test for Comprehensive Hormones. And it's the top of the line functional lab test for hormonal testing. So I'm going to go through a Dutch report with you guys today and explain what I'm looking at when I do hormone testing with patients and the options that we have then for treatment. So after we get lab tests back, we review them in a 45-minute appointment. We never just send you your lab results through the portal, at least not for these comprehensive labs, because with it being, over 10 pages long, and not most of my patients don't have their own medical training, even if you had medical training, they're so comprehensive that it takes a long time to really learn and understand how to read it quickly. When I first started doing this type of test, every single lab that came back the first 10 times, I had a half an hour consult with an experienced clinician at that lab to help me understand what I was looking at. So this lab test will give us so much information, more information than any conventional test you've had done. And we will apply the recommendations based on your biochemistry according to the therapeutic order. So I'm going to open this up and kind of explain this philosophical part of how we approach care. The therapeutic order provides a framework when we help patients. So there's 7 levels on our therapeutic order. Level 1 is the base or the foundation. We absolutely always have to establish a strong foundation for health to exist. Now, these are the daily things that you either do or don't do that will help drive health or drive illness. They're the building blocks of health, or what we call in naturopathic medicine, the determinants of health, the things that are literally determining your health Include your nutrition, hydration, fresh air, sunlight, supportive relationships, sleep, physical activity, maybe looking at genetic factors or environmental factors. So when these building blocks are strong, health tends to exist. When these building blocks are weak, or the determinants are not being met, then health tends to go down. So health is very fluid, and it's not a static goal to attain. It's not like a gold medal that once you have health, once you're healthy, you'll always be healthy. Like, if only it were that easy, I would be the first in line, like, sign me up. But we have to really work on those day in, day out efforts. Then level 2 are self-healing mechanisms. Our body knows how to heal, and it's constantly trying to get us well. Sometimes when it's stuck, there are gentle therapies that can just free and enhance your body to do what it's trying to do even better. So things like acupuncture, hydrotherapy, aromatherapy, meditation, yoga, those sorts of things. So those therapies have very low potential for negative side effects, yet they can free and enhance your body to do what it's trying to do. Then support and restore weakened systems. With this level, nutrients and herbs start to come into play, where we can use specific nutrients and herbs that have affinities for specific areas of the body that we need to support. For example, if somebody has chronic stress and fatigue, we might use nutrients like B6 or herbs like rhodiola and ashwagandha to help nourish the adrenal glands, which are responsible for stress response. And then level 4, physical alignment. Structure determines function. So if there's a structural cause behind a physical ailment, physical medicine modalities are typically the best to help address that. An example of this one would be if you have a herniated disc in your back, pressing on a nerve, causing pain. While other levels, like taking an anti-inflammatory, might help the pain a little bit, but at the end of the day, if you saw a chiropractor, physical therapist, really worked on getting that disc back into place, fixing the structural cause behind the pain, well, then naturally the symptom of pain would go away. Then level 5 is natural symptom control. Sometimes when patients come to see me, they think that this is the level we're going to operate on, is essentially give me something natural instead of a pharmaceutical, right? So give me an herb instead of a medication. So we can use Band-Aid fixes like that. Sure, we could swap one for one all day long, and chances are you would feel better. You might have less potential for side effects than conventional medications, but at the end of the day, it's still not addressing the reason that the problem is there. So we can use this level, and we do use this level because it works quickly and it gives us time. And with that time, we really need to look at everything else down below to really strengthen our base, work on the determinants, help your body heal, support the organs and systems that need some support as well. Then conventional medicine is on the top 2 levels: synthetic symptom relief like medications, high force interventions like surgery, chemo, and radiation. There's absolutely times and places for those measures. But the reality is, in the conventional medical setting of the United States, when you go to the doctor, you're typically put up here right away. Where conventional practitioners only have a few minutes with you, so they don't even have time to talk about anything down below. Even if they had time the day that they meet with you, they don't use these levels down below enough to be able to confidently recommend or manage care with them. So this is where naturopathic medicine really comes into place, where we need to work on the whole being, work on strengthening the things that are causing you to be out of balance. All right, so back to the PowerPoint. Are there any questions so far? You can feel free to either unmute yourself or type it up in the chat box. Okay, nothing's coming through. All right, so I'll go back to our presentation over here. All right, so now I want to talk about some hormones and symptoms that you could have with deficiency or excess. So progesterone is a big one for women. Progesterone deficiency can lead to any of these symptoms: irregular menstrual periods, headaches, difficulty conceiving, mood changes, anxiety or depression, trouble sleeping, hot flashes, bloating or weight gain. So you need progesterone. Progesterone is made from the corpus luteum, which is the structure that's left behind after the ovary releases the egg. So when the ovary releases the egg, the structure on the ovary remains. That's the corpus luteum, and that's where your progesterone comes from, which is why it can cause some of these. Then androgens are a classification of hormones that include DHEA, DHEAS, etiocholinone, androstenedione, testosterone, and people could have either deficiency or excess of androgens. Deficiency, things like vaginal dryness, decreased sex drive. For men, increased belly fat or apathy, or an excess of androgens could lead to loss of scalp hair, acne or greasy skin, increased body or facial hair. So for women, like facial hair that shouldn't be there, or even hair around the nipples, or going from the belly button down to the pubic area. Or for men, excess androgens like testosterone could cause aggressive behavior. Then estrogens deficiency could be hot flashes, night sweats, vaginal dryness. So think about menopause. Essentially, those menopausal symptoms oftentimes are due to low estrogens because your body now is not making as much. Or an excess, tender or fibrocystic breasts, or for men, breast growth, mood swings, uterine fibroids, heavy bleeding, prostate problems in men. So it's a balance, right? You got to have the right amount, otherwise you can have symptoms. Now here's the thing: when you have hormonal symptoms, chances are you're having symptoms in all of different of these, all or any of these categories. So it can be challenging to pick out what is it for you, right? Is it one deficiency or excess? Is it more than one? That's where a testing comes in and is very beneficial. Then cortisol. Cortisol is a really important hormone, and it is supposed to follow a certain pattern or a curve where at nighttime when you're sleeping, it's low. Then in the morning, you get the surge of cortisol, which helps you get out of bed, start your day, have energy. Then in the afternoon, it starts to lower and then taper off before bedtime. So cortisol goes opposite to melatonin. When melatonin is high at night, melatonin is a sleep hormone, cortisol should be low, and vice versa. So cortisol, I decided to put some pictures because I thought these were fun. Low cortisol, you could have a lot of fatigue or that afternoon slump. Too much cortisol, you could have excessive belly fat. You could also have really bad sugar cravings because instead of the cortisol, which is kind of a sustainable energy source, you have to look for those quick energy sources, the sugar, essentially. So I mean, how many of you still have Halloween candy at home, and who's blown through it already, right? So people who have poor control with sugar might be an issue with cortisol, among other things. Other causes could be there as well. All right. Okay, so then other thyroids. Now, this is not included on the Dutch test. And again, I'm going to go through the Dutch test report here in a minute, but I just want to mention these, that hormones are so related. Actually, maybe I skip let me skip ahead to this. When your hormones are all in balance, it's a beautiful concert. Like things are running smoothly, you feel really well. Or let's say a few instruments are not tuned properly, doesn't sound quite good, right? It could be the most beautiful concert or not. So thyroid plays a really important role too with how you're going to feel hormonally, and oftentimes imbalances in reproductive hormones could also mean there's imbalances in thyroid hormones. I'm going to talk about this a little bit more later on. Okay, so the advanced testing that we do at Thrive is called the Dutch test. DUTCH stands for Dried Urine Test for Comprehensive Hormones. There's different levels of Dutch testing. The one that I'm going to go over is called Dutch Complete. So there's a level that's like one step down from that. There's some levels that are higher than that, but this is the most commonly done one at our clinic. It's the most comprehensive hormone test out there. Test, don't guess. And then with the results, we can be very specific with our natural therapies to get your body back into balance, because we're looking at your biochemistry uniquely to you. So what does it entail? Let me pull this up. Okay. Here is a sample report, and I'm going to read through what I look at when I get a report back and all the information that it's going to provide us. So the first page is a summary. Everything on page 1 is much more in depth on the following pages. So first, the key, how to read the results. We like to see for premenopausal women or for men, the range would be between the 2 gold stars. I should say, I said that about men. The men have a different guide on their, a key on theirs, so they're not going to have like a postmenopausal range. So I just want to clarify that the results are going to be specific for the gender as well. And then also postmenopausal range. So if you're a woman of reproductive years, you would want it between the 2 gold stars. If you're postmenopausal, in the little purple section. So with the dials, you can have a quick glance about where you are. Then the adrenal page, it gives you a curve that we'll look at more when we get to that page. It also shows metabolized cortisol, which indicates your adrenals' total production of cortisol. And then DHEA production as well, which is the androgen category. All right, what I like is that it gives us everything in a flow chart so you can see how your hormones are made and broken down. Hormones are driven, for proper hormone production, you need healthy fat sources because hormones come from steroids. So the first hormone is called pregnenolone. And pregnenolone will feed both into progesterone as well as your androgens. So on the progesterone side, it will show us progesterone, but also the 2 metabolites. Metabolites are the breakdown products when your body is clearing it out of your system. And sometimes an imbalance of metabolites can be more of a driver behind signs and symptoms than the main hormone itself. So with progesterone, it looks at the beta and the alpha. And if we look at these dials like eyeballs, we want the eyeballs to be pointing in the same direction. So right here, there's an imbalance of the way that this person's body is breaking down the progesterone. They're skewed more heavily on the alpha side, and that can cause more symptoms. We're going to talk about that over here in just a minute. So then your androgens, DHEA, after menopause, most DHEA production is made by or I should say most hormone production in general is made by the adrenal glands. So DHEA needs to be sulfated. So sometimes, let's say a conventional doctor might look at DHEA, but they don't check DHEAS. Well, was your body able to sulfate it? Did it have the proper nutrients and cofactors involved here? The sulfur group, so eating sulfur-containing vegetables, is really important. Then it looks at androstenedione, testosterone, etiocolonone, androsterone. So back to this 5-alpha reductase activity, that's the enzyme that is helping here as well as over there. And when women have a preference skewed towards the 5-alpha, that's when more of the hair loss, greasy skin, acne come into play symptom-wise. It also looks more specifically at age-dependent ranges. So again, we're narrowing this conventional reference range down to, okay, what is the most healthy for my age range? And then you kind of go reference the dials, see, okay, this person is clearly low in DHEAS. Let's check their testosterone. I think this person was 50 or something like that. So in their age-dependent range, still good there. Etiacolinone, however, they should be at 300, they're at 232, so suboptimal for their age-dependent range. Then with estrogens, E1, E2, E3, there are 3 types of estrogens, and they can break down through 3 different pathways. So many times I find that people who have symptoms, even if their main estrogens are fine, like their estradiol, it's because your body is not clearing them properly. So this provides us very valuable insight that a blood test alone would not provide us with. 16-OHE1 is the most symptom producing, where if this is high, often any sort of estrogen excess symptoms, estrogen dominant symptoms will be exacerbated, like breast tenderness, heavy periods, mood swings, irritability. Then the 4-OHE1 pathway is the more dangerous DNA damaging pathway. And this is the metabolite that's more responsible for estrogen-dependent cancers. So it can increase your risk of estrogen-dependent cancers. So if you have had an estrogen-dependent cancer or a family history of estrogen-dependent cancer, I'm definitely paying really close attention to this dial. And then the 2-OHE1 is the more health-friendly pathway. This is, we want it to be higher on this side. And then it goes a little step further to look at, once we get to this metabolite, how are we getting it out of the body with 2 enzymes. So COMT is an enzyme, and then there's enzymes with methylation. If your methylation is off, so let's say this dial is really high. Well, is it high because too much estrogen is coming down, or is it high because this methylation is really slow? If you have low methylation, that's what could increase, lead to a buildup. And then we're going to take that into account, say, okay, we got to figure out, why is your methylation slow? Is it a genetic SNP, SNP, single nucleotide polymorphism, which is like a genetic mutation? Or is it because you need more of the cofactors, the vitamins involved with the methylation? All right, so this is the first in-depth page we look at. Then the adrenal page that it looks at, it really shows the depiction of what's going on to make this all happen. So when you're exposed to stress, a center of the brain called the hypothalamus releases a hormone that talks to the pituitary gland, which will then talk to the adrenals. And the adrenal glands will make a variety of substances. 2 of them are DHEA and cortisol. And cortisol needs to be circulating free in your bloodstream to be able to move in and out of cells to do its job. So the free cortisol in the morning, we like to see it kind of low. Then it'll raise about 2 hours later. So a few hours later, she'll be higher. In the afternoon, it should dip and then taper off before bed. Now, without knowing anything about this sample patient, I would say they probably wake up, they're on the high side of normal when they wake up, maybe their heart's racing, like jittery, like frantic start to the day. Their energy probably doesn't get much better, but then in the afternoon, they're totally crashing, like maybe reaching for coffee or caffeine, want to take a nap, just feeling totally lethargic, hard to focus and concentrate. And then they don't get much better before bed because it's so flat. So those are some symptoms that can happen. Now, for patients, let's say, who at nighttime their cortisol is too high, well, then you have difficulty falling asleep. You might feel like you're more productive, but that just really wears your adrenals down because you're not getting the rest that you need at the time when you need it, when you're supposed to be sleeping. Between 10 p.m. and midnight is some of the most restorative hours for sleep. And then it also looks at cortisone, which is a free storage form of cortisol in the bloodstream. So the cortisol and cortisone go back and forth pretty easily, and we like these curves to mimic each other. So when we add these up, the metabolites of these up, cortisone metabolites are called THE, cortisol metabolites are called THF. When we add them up, that's when we get this dial. So this really indicates your adrenal gland's total production. This person's production is so low. They're below their reference range. So their adrenal gland is not functioning well, adrenal hypofunction. So chances are they've been worn down from chronic stress over time. And now it's like they have to try to push through the day and they don't have that natural, just feel good energy. When metabolized cortisol is so low, another thing that I consider is hypothyroidism. A lot of times hypothyroidism goes in line with low metabolized cortisol. So on a patient like this, that's definitely on my radar, and we would look more into thyroid health as well. Then this little fan gauge is showing how much of which metabolite is being cleared out. We like to see it in the white, closer to middle is better, but when you're very heavy on the cortisone metabolites, two main causes behind that: chronic stress or chronic infection. So there's been a few times where I've helped patients identify some underlying chronic infections that were also contributing to poor energy because of this metabolite specifically. Then the cortisol metabolites, if that one is too high, more cortisol metabolites can be insulin resistance or poor insulin regulation, chronic inflammation. Those are the two big ones that come to mind. So when I'm looking at this style, I'm really thinking more about the whole person and what else is going on in their body. The test also includes some nutrients and neurotransmitters. So it looks at a B12 marker, B6 marker, biotin, glutathione. So glutathione is an antioxidant that the liver makes. It's very important. So this person likely needs some more of the building blocks of glutathione, like N-acetylcysteine. A gut marker, indican. So if this is out of range, it could be dysbiosis, like leaky gut, or gut infections going on. Neuromarkers: dopamine, norepinephrine, epinephrine, neuroinflammation marker, melatonin, and oxidative stress. So that's what the Dutch test is looking at, the Dutch Complete. So just going back a second, I touched on thyroid. I'm going to go back to that one. Since I mentioned it, that it's something where if metabolized cortisol is low, it's on my radar right away. Conventionally, they typically look at TSH, which stands for thyroid stimulating hormone. That's a hormone that's coming from the pituitary gland in the brain to talk to the thyroid. So it's seeing, is the brain sending the signal? If that's normal, most conventional doctors stop right there. Occasionally, they will look one step further at free T4. When the thyroid gets the signal from the brain, it's supposed to make T4. However, T4 is not the hormone that's metabolically active. It's not the hormone that's able to go in and out of your cells to regulate your metabolism. It needs to be converted first to free T3. So free T3, occasionally, again, like every step we go, it's less and less in the conventional realm that they would look at. Free T3 is what's really important to check to see, okay, did your thyroid get the signal from the brain and then make the right one and then convert it in the right amount? The reference range for free T3 is pretty wide, like bottom of the reference range is 2 and it goes up above 3, up above 4. But for optimal health, I like to see a free T3 between 3 and 4. So often I've had patients say, I have all these thyroid symptoms. They keep telling me my thyroid is normal. I don't know what else to do. And I really do the comprehensive panel. I say, well, here's why. Your free T3 is the bottom of their normal reference range, which is already substantially lower than where you're going to feel well. So we can help address things right away. Reverse T3, it can block the receptor site on the cell for the T3. So if you have too much of this, a lot of times excess cortisol causes this to go up. And then antibody markers, because many times low thyroid function can be due to an autoimmune condition called Hashimoto's. All right, so we went through the test. Now let me talk about some takeaways regarding how we would approach care. Obviously, I'm looking at the Dutch test results really closely to figure out your biochemistry and what you need. But here are some general things that that come up quite often, like zinc, selenium, and iodine. Zinc is really good for the ovaries, selenium and iodine and zinc, the top 3, they're all good for the thyroid. Sulfur-containing vegetables, because you have to help sulfate the DHEAS. The brassica family or cruciferous vegetables, it's like cabbage, cauliflower, broccoli, and those help with shunting the estrogen clearance through the healthy pathway and away from the DNA damaging pathway. Essential fatty acids, amino acids, chia and flax seeds, more for their gut health effects, because as the liver packages up these hormone breakdown products, the metabolites, it will put it into the bile, and the bile goes into your intestines. And then from there, it needs to leave with your stool. So it'll be kind of packaged up with your stool. If you have something like chronic constipation and you're not going to the bathroom regularly, there can be bacteria in your intestines that undo the packaging that the liver just did of those hormones, and then they can be reabsorbed. So chia and flax seeds can definitely help the gut moving, as well as a host of other things. So that was more of a side note. Gut health is so tied to hormonal health as well. Then herbs, rhodiola, ashwagandha, licorice, maca, cohosh, chasteberry, red clover. There's so many herbs we can do. And again, we're looking at the enzymes specifically that we need to support based on the Dutch test results to be able to pinpoint which recommendations are the best in your case. So I want to open this time up for questions. Oh, I just see one message in the chat box. Oh, somebody said love red clover. Yeah, love it too. So if you have any questions, please type it up right now and I will answer your questions. I do like to mention, if you have not seen us for naturopathic medicine yet, the initial consultation we can do either virtually, so telephone or video chat, or in person at our office in Milwaukee. We have the virtual option for anyone, even if you live close, but we do have patients from a variety of states, including Tennessee, Michigan, Illinois, Wisconsin, Texas, so we can see people virtually as well. There's the website you can go to. Does anyone have any questions? Feel free to unmute yourself or type it up.
I have a question.
Yes.
I'm sorry if I missed it. How often will you meet, like, after the initial testing? Like, will you have to come like 10 times a year? Like, is it I have the appointment, then I have the next one, and then I follow up? How is that
that's a great
process?
question. So typically when we meet for the first appointment, if it's in person, we'll give you the test kit right away. Or if you're virtual, we will have the lab ship the test kit to your house. Then you collect, you send it in. We would meet for the follow-up whenever the lab comes back. So for women, if you have a cycle still, you have to collect on a certain day. So, you know, it might be a month or two before we meet for the follow-up. And then oftentimes we would check in 1 or 2 months after that lab review appointment, just to make sure things are going well, adjust the plan if needed. And from there, it tapers off. I would say monthly for the first, I would say we would see each other monthly, maybe 3 to 4 times in most cases, and then as needed after that. Some people like more consistent accountability and keep coming back monthly to work on the diet and the lifestyle and things like that. Other patients, you know, after a time or two, they feel like they're on a good path and that's it for them. So it varies based on the person, but in general, monthly for a few months and then tapers off. Okay, then we had somebody type up a question. How much is the Dutch testing? Great question. I forgot to mention that earlier. So the Dutch test, there's different levels to it. The Dutch Complete, which is the one I just went over, is $499. There are higher levels that go $650 or even more than that. Then there's a one level that's less, that if you only want to do the female hormone panel or you only want to do the adrenal panel, it's $399 instead of $499. And then another question here. My question, are there 3 different tests? Because I thought you were discussing the complete test. Yes, so I reviewed the Dutch Complete, which is the one that I went over and I was showing everything we were looking at. But there are different levels, and in certain situations, a patient might need a level that's higher, or they might only want to do a level that's lower because of finances. Thyroid testing, another question came in. Thyroid testing is an additional cost. The thyroid test, if we do that comprehensive panel that looks at 6 markers, that's $198. Another question came in. With Dutch results, do you guys provide the nutrition and herbal medicine, or that's an extra charge? So supplements are an extra charge. We'll provide our recommendations. We do have the supplements in stock and the prices are on the bottle. So we will talk with you about the finances. And if you have financial constraints, we can definitely help you prioritize and also maximize what you can do with nutrition and lifestyle at home. The goal is to not have you on a supplement forever. The goal is to use the supplements as a boost to help get you back into balance. And as you start to feel better, we taper off. Any other questions? Okay, it seems like that's about it. Oh, one more question just came in. Why don't OB-GYNs look further into this? That's a really good question. I think it's because of the way that conventional medicine is set up in our country, where conventional practitioners are in and out of the room so quickly, and they don't have time to really dig deeper and look at all of the factors involved. And also they have their quick Band-Aid fix, which is oftentimes birth control or hormone replacement therapy. The training is different for conventional doctors versus naturopathic doctors. So we're really focused on health optimization and fixing the causes behind your ailments versus disease management. Another question. Do you provide the supplements to help with problems found? Yes, the supplements that we recommend, we typically have in stock. You're not obligated to get them here, but we do have it here for convenience. Okay, I think that's about it then. I'm so happy you guys all joined me today. We'll send out the recording, if not today, hopefully tomorrow or the next day. And I hope to work with you soon if we're not working together already. You could either schedule an appointment with me or the other naturopathic doctor, Dr. Janice Jorgis. She's also very well versed in the Dutch test as well. Oh, and somebody has one last question. Is the sauna room up and running? Yes, we started, we got the infrared sauna and it's been up and running since the beginning of September. So you can definitely reach out and we can get you scheduled for that if you'd like. All right, take care, everyone. Have a great afternoon.
I got a quick question. I'm sorry.
Oh, yeah, no problem.
Do you offer like initial like consultation appointments so we know which tests would be suited for us? So say I'm
In
like,
the
I don't know
initial
if I want to do the Dutch, like, so do we pay for like an initial appointment with you guys to decide which test?
Yes, exactly. The
Okay.
initial consultation, you would schedule that first, and then we can meet and figure out everything you have going on to be able to best recommend which tests you need.
Okay, thank you.
You're welcome. All right, everyone, have a great afternoon. Thanks for joining.